Hello and welcome to EMDRCM Live. This is an outreach of the Executive Master in Disaster Risk and Crisis Management from the Asian Institute of Management. This is episode 4, and we are going to talk about the current crisis that we are facing, COVID-19. But before we move to our topic at hand, just a short message to those who were really anticipating our talk on women leaders and their social impact and disaster. We had to make some adjustments because of some work emergencies that had to be attended to by our guest speaker. But for this live streaming, we are very fortunate to have with us one of the distinguished visiting professors at the AIM. He is actually also a visiting professor at the National University of Singapore. And I will just have to check my phone for the rest of his credentials so that I don't miss out. He was formerly Director General of the Independent Evaluation at the Asian Development Bank. He was Director General and Senior Vice President of the World Bank Group and a country director that organization in Brazil. And he has his expertise lined up in disaster risk management, economics, economic and trade policy, program evaluation. So, friends, please welcome our very experienced and wise guest, Professor Vinod Thomas. Hi, Professor.
Thank you. Thank you very much, Wally. Thank you for having me.
Okay, before we deep dive into the topic of our live stream, maybe you can share with us how you got into disaster risk management.
We have been evaluating the performance of projects at the World Bank and then later at the Asian Development Bank in terms of their success in delivering what was promised. And I was in charge of overseeing the evaluation of thousands of projects. So there were a lot of lessons out of that on how projects in some countries have worked so much better than others and some common lessons. So that led me to this current interest in the disaster management. But just to add to that, climate change has changed the calculus so completely and of disasters. I would say multiple disasters. The stakes have just been lifted to a different level, and that brings out the huge priority for prevention or avoiding ahead of time the worst case scenarios rather than only react after the disasters hit us.
Okay, so to your sharing about your involvement in evaluating projects for the World Bank that led you to see some of the impacts of climate change in terms of disasters, that's actually the theme of our conversation this afternoon about COVID-19 highlighting the urgency of a greater disaster resilience because from the notes that you shared with us earlier, it is a fact that we cannot ignore the other disasters that may come our way in the coming weeks or months.
Absolutely. The COVID crisis is sort of sandwiched between the Tal volcano calamity, and it's surely going to be followed by, in the coming 3 or 4 months, floods and storms. And each year we've been seeing an uptick in the intensity and frequency of climate-related floods and storms. So the question of how a country, any country, and now in the case of the Philippines, manages multiple disasters is probably the new challenge of the day. In the financial sector, we do so-called stress tests to see how the financial system would react if 2 or 3 calamities happen at the same time. And in this case, it's very high time that the Philippines, at the provincial level, each province would do a stress test of its ability to cope. And in the case of the coronavirus, specifically the availability of test kits, diagnostic equipment, hospital beds, etc., all available in time, and how short we are in terms of the likely projection of those who could be infected and in serious condition.
Okay. Would you be able to share with us, Professor, an example of anywhere in the world where they have multiple disasters or hazards happening at the same time, and what were the major lessons learned?
Right. So, in the case of the health sector, in the case of the health area, interestingly, the Global Health Security Index that was published in November from the United Nations ranks all the countries of the world. And unfortunately, the answer to your question would be the average for the world out of 100 is a very low number. It's only 40.2.
40.2.
That means, out of 100, that's a failing grade. So in any school. So on average, no country is nearly capable of handling 2 or 3 disasters at the same time. Now, the Philippines is above average and has a 47.6, and it's the 53rd out of 195 countries. It's
a good thing,
only
Professor.
to that extent, but it's still a low number in terms of the preparedness for multiple disasters. Now, just for the record, the United States is ranked number 1 according to that index, but you can see the limitation even of that index in the current situation. The ability of the United States to have enough test kits is in huge question, let alone enough hospital beds or enough health service available. So if you think of one country that can do it all, I mean, there has been occasions where Japan has managed multiple disasters pretty well, ranging from heat wave to floods and earthquakes. So, but still it's all a relative scale. Philippines, in a way, over the last 20 years has made progress. It has improved its ability to anticipate, for instance, the fatality under a given flood or storm is much lower today than it used to be. So the lessons have been learned. Early warning is much stronger, but the distance travel in view of the increasing intensity of the disasters and the multiplicity of them is nowhere near where we should be.
Right. And the problem with COVID-19, this is a totally new problem that the world is facing, that the World Health Organization just labeled it a pandemic. Now, just for those who are watching us, while they have declared it a pandemic, the World Health Organization is saying their response and mitigation remains the same, and we should take care in sharing this information because we don't want to spread further fear and panic in the general population. So, Professor, to your point, this is a different situation we're faced with. We're just coming from Taal. We're going into the rainy season, and we are amidst this outbreak here in the Philippines, and the government, they're trying their best to really contain the situation, but admittedly, the public is scared. So what would be your advice moving forward?
The best remedy, in my view, is to overreact without panic. If there is such a balance that you could institute, I think it is better to overreact in terms of prevention, namely avoiding all the list of things that are high-risk activities, crowded areas, hygiene practices, avoiding risky behavior, all of that, crowded or transportation as well. So those would be overdone to the extent that I was just looking at a study that showed that where meetings and gatherings have been postponed, the difference in the infection rate is extraordinarily, strikingly lower. So it is a very high payoff investment. However, panic leading to draconian actions that can be counterproductive are also a problem. So ideally it would be react extremely with low degree of overreaction in terms of panic. So that would be the way. Now, in the case of the Philippines, one has to also keep in mind that the vulnerable groups are particularly vulnerable, the aged people, the medical workers, but also those who are in situations where they really are unable to control their own environment. And so caring for the highly vulnerable has a particularly high emphasis in the case of the Philippines. And so having access to them and them having access to medical care is also extremely as important as keeping them isolated.
Thank you. You've outlined 6 priorities, Professor, but before we go to the 6 priorities you mentioned, I'd just like to ask for your opinion about all this talks about a lockdown of Metro Manila.
The idea of a lockdown may have gotten some support in the case of China, where there were identified epicenters like Wuhan, Hubei province, and when the concentration is so high, there is logic in minimizing the to and fro flow of people into that area, because that will be the largest multiplicative impact. Whereas now, if it is much more communal, spreading all across, that loses that particular edge. Also, in the case of a lockdown, one has to worry about the access the vulnerable and others have to medical and other facilities that are vital for survival. Italy has a lockdown at the national level, so where it is clearly one where the area being locked down is the entire source of multiple infections. There is some evidence from China, for example, that is beginning to work to the extent that the data can be taken at face value. Then the decline in the rise of cases in the case of Wuhan and Hubei are extremely significant. I mean, they've been quite dramatic more recently. But I think here is a question of balance and common sense, and the point that we made earlier, that if it is done with panic, and a lockdown comes with panic and a sense of helplessness, that could compound the situation even more.
Okay. And just to reiterate that point, that it has been proven, as Professor mentioned, it has been proven that it can work, but it has to come with real careful planning, and it has to be communicated. I guess also to that point, Professor, it has to be communicated quite well so as to manage people's emotions and perceptions. Let's move to the priorities that you have shared with us. So I read through them, and then you expound further so that our live stream audiences can understand better what you mean by them. So you mentioned here, the first and highest priority is to protect the Philippines' high-risk groups, the elderly, the sick, the frontline healthcare workers.
Right. I think in a case like this, where there isn't yet a vaccination and where there is no cure per se, the attention and the care and the access to palliatives and things that you can use to avoid it becoming fatal are the name of the game. And so those who are vulnerable, and until very, very recently it was being accepted that the elderly are the most vulnerable. Now there are cases in Italy that raise questions even about that. But that said, clearly the elderly are more vulnerable, and the frontline health workers who may be less protected in many ways in the Philippines, them being priority in terms of getting this type of support because there is no other vaccination and other solutions, clearly rises to the top in terms of life and death.
Right, and to add to what you mentioned, Professor, if, for example, the panic buying of masks which
Right.
currently has put the global supply at a very, very low level, would compromise medical workers. And if their health is compromised, then we get to a bigger problem. Okay.
That's an excellent example of the point I was making.
Okay, so sa second priority, clear surveillance protocols are needed. When you say surveillance, surveillance of what particular aspects?
So in this case, of course, we are looking at a situation where the whole thing rests on reliable information on who is positive and what is the chain of events that preceded that. And so surveillance protocols on who would need to get tested, what is the threshold at which you should seek a test, and then the most crucial one, that test kits are available. And it is worrisome that in the Philippines we have a serious shortage of that. Just like in the United States, there's a serious shortage of that. And then the tests themselves, when you go to a hospital, we have now the more recent experience that they are not the safest place as it turned out in terms of contracting the infection. So are there possibilities of pop-up and drive-by testing that avoids, again, going to crowded areas with a higher risk of being infected and making the problem even worse? So the set of rules of the game, or at the provincial level that can be implemented, that are taken together called the protocols, one, need to be clear. Two, they need to be communicated not only to the health workers but to the population at large. And for that communication to be taken as serious news, will have to be built on credibility. And recent experiences we have seen across the world that when a country loses a bit of the credibility from underreporting or non-transparent communication or delayed communication, like in the case of China, the province of Hubei, on the coronavirus, then the later communications will need that much more effort to make it credible. So the honesty of communication and clarity, of course, of the protocols would be extremely critical.
Professor, would you think that the complexity, for example, of the prevalence of poverty in, for example, urban settings in the Philippines would further complicate this part about your second priority in surveillance?
The point you were raising, I lost a bit on the audio. The complication to the setting up of protocols and its relation to the health systems is a point I would have made, in the sense that if the health system, both the investment and the spending on that, and therefore the availability of personnel to work on the protocols and to implement them is limited, then we have a serious problem. So the whole thing is connected to the history of investments and spending on the health system, and there are serious shortages when it comes to that in many of the Asian countries, and that is a lacuna that we are learning the hard way. In the interest of economic growth, if the spending priorities move away from health and education, we pay for it the hard way. Eventually, it hurts the economic growth itself. And so we have case after case where health expenditures have been cut, the ability for the health professionals to work on these issues is compromised. The protocols we talked about are going to be on paper without the people to implement it, and therefore the health is at risk, and productivity and growth in turn suffer.
I'd like to reference the framework that you shared in your book about climate change and natural disasters, where you mentioned that the level of investment you put into your mitigation will have an impact on the cost that you will be spending for prevention. So, and also with adaptation.
Absolutely. I think that has clearly a parallel to the health sector as well, but taking natural disasters and health combined, the lesson is that our tendency, of course, is to cope with a disaster after it occurs. But especially in settings like the Philippines, where you know there were going to be series of disasters, the question is exactly which month and when, then the priority for mitigating, that is to some extent preventing, we don't prevent them completely, but minimizing them would have such a high priority compared to only coping. And so in this one study that IPCC has used heavily, if we spend all our resources entirely on adapting to climate change, and very little mitigating, changing carbon footprint, switching off our fossil fuels and moving fuels, through adaptation, incidence of carbon emissions, global warming, therefore storms, and along with adaptation. All the things we discussed, which is preventing, investing in the health systems, having the protocols ready, having personnel to deliver, and the Philippines gaps, 33,000 patients per doctor, 1,121 patients per one hospital. Those would be the areas where you can see that investments can fruitfully be increased.
Just to clarify, because we lost you for a minute there, Professor, you're saying that when we start looking at mitigation and prevention, we have to really strike a balance between the current need to provide for the welfare of the population, but also set in the mechanisms and the systems so that, well, in the future, pandemics like this can be properly addressed. Like the data that you shared with us, this is quite troubling. There is only one doctor for 33,000 patients and a hospital bed for 1,121 patients in the Philippines. So clearly something has to change in that aspect.
That's right. I think that's one set of estimates. And again, it's not just the doctors, it's the whole system. So, at all different levels of the health system, especially when it comes to public health issues, there is a need to fortify investments. I think when we think about future needs versus current needs, it really would not be a trade-off in the sense that we clearly have to give priority or emphasis to coping when the disaster strikes, right? I think there is no question that saving lives and taking care of those who are vulnerable right now is a top priority. But that's no different from saying that this will happen again. So if you're worried about the vulnerable today, you're worried about the vulnerable tomorrow. And so a part of the investment and expenditure would have to be, to use a term from the natural disaster world, build back better. That the next time it happens, the prevention would be a different order of magnitude.
So can I simplify that, Professor, by saying at least we try to decrease the number of vulnerable people year in, year out?
That's exactly right. As we deal with the vulnerable today, we try to decrease the number of vulnerable and our ability to provide for them before the next one hits us.
There's an interesting line, Professor, that in your outline you shared with us. Our government health expenditure as a share of the GDP in the Philippines is low for a middle-income country. Can you explain that?
Well, I think Philippines has, for its income level, improved the health spending, even as the out-of-pocket expenditures of the person is still high. And so there is a burden of the health expenditure on the Filipinos. That said, the comparison when you are dealing with multiple disasters is to a middle-income country with a certain growth rate and Philippines is a lower middle income country. And so, let alone a comparison with OECD country, the percentage that is going to health and education, but health in this case, would need to be increased, in my view, to be able to withstand the kind of health risks and disasters this country is facing. So I think there is a very strong case, not just to increase the amount, but to improve the efficiency of its use.
And that goes back to your point earlier about balancing our adaptation to our mitigation and prevention measures. Let's jump to the fourth priority that you have outlined. The Philippines, like other Asian countries, should strengthen partnerships between private and public sectors and with other countries.
Well, this one is proven to be a rather important one in that partnership with other countries and with international organizations like the WHO has proven to be a critical piece. Now, Thailand was rated 6th in that ranking of 195 countries. And one of the reasons was the speed with which, when the Middle East, that's also coronavirus, Merck, hit Thailand, the very first case, they very swiftly informed WHO and was able to stop the infection on the tracks, and one great congratulations for that. And so it goes back to the relationship between the local organizations, the scientists and so on in the Philippines with the international. So that link is critical. But I also wanted to mention that the link within the country, of course, across municipalities and with the central government, but also public and private sector is very important. Here, to the extent that the departments of health work with pharmaceutical companies, the whole issue of things like the test kits and supply chains and so on can be much better addressed. So the question would be, how closely is the public and private sector working together and decisions being made, as well as province with the central government.
Just to add to what
And the relationship.
what you mentioned,
Yeah, the
Professor,
relationship.
I came from the private sector, and for the most part, the involvement of the private sector has always been to share out resources, contribute or donate to efforts of the government, but it's never been a deeper engagement than just the resources.
Yeah, well, I think there's a lot to be gained both ways by integrally involving the two sides from the beginning of the process.
Okay, now this is quite interesting because this pushes back to the first point you raised about climate change and us not neglecting the very real data that's around us, that it's impacting the impact of current disasters. Priority in tackling the growing environmental link with new viruses and the dangerous interaction between particulate matter and viral respiratory tract infections. So this goes to your point about climate change and its impact in amidst all of this, this emerging disaster and what will come in the future.
Absolutely. I think the most visible, tangible evidence is the link between particulate matter, pollution, air pollution, the microparticulates that get lodged in the lungs, and respiratory illnesses associated with the new coronavirus and so on. And clearly, the two makes it extremely difficult for people to cope. So dealing with the environment is a health policy in that sense. At a bigger scale, however, the warming of the earth and the sea level temperatures and the accompanying complications and observations and scientific papers that are suggesting that new viruses or new illnesses, everything from more water being lodged in areas leading to mosquito-borne diseases, but vector-borne diseases more generally associated with climate change, is increasingly accepted in the literature. And that would be a cause for huge worry that not acting on climate change, not switching to a low-carbon economy, is not only problematic in terms of natural disasters, but it's hugely problematic in terms of health disasters.
That's very interesting, and it would help everybody to start thinking about it. That disasters, for example, COVID-19, doesn't happen in a vacuum. It's happening in this day and age when climate change is a crisis in itself, and that we have to factor in all of our mitigation, prevention, adaptation strategies to make sure that nothing is left to chance, right, Professor?
Absolutely, I agree with that.
The last priority you mentioned here is the need for clear communication of protocols, explaining risk levels, and needed action to help health professionals and the public to prepare without panic. You mentioned earlier over prevention without the panic. So I think this hypes that part about your sixth priority.
That's right. I think although it's mentioned as a sixth, it really is a frontline concern because panic buying can drain the resources that are necessary for high priority purposes and also can be misleading in terms of the priorities. But at the same time, you need to be ready. And so the right amount of overreaction without panic and the only key I can think of that there is really education campaigns that work and involving highly credible, honest, and transparent communication so people can believe the numbers and act accordingly. And announce a small amount of credibility at the beginning will go a long way to making communications not only smooth but also credible as you progress.
Okay, so those are the six priorities that Professor Vinod has outlined in his sharing with us. Now, we know you're very busy, Professor, so we will not keep you longer, but maybe your last word about this point that COVID-19 highlights the need for us to look at the greater resilience, the need for greater resilience for the Philippines.
Absolutely. I think you can think of resilience as the flip side, an image of risk. And so clearly we're facing a high level of risk in the Philippines and also a growing degree of risk in the Philippines, heavily contributed to by climate change. And that means that if you want to think of it as an opportunity to building resilience is that much greater. It's really the urgency to build resilience that's greater, partly through the financial investments, seeing resilience as part of the development agenda and not as a unnecessary expenditure that you are having to forced to be made. And so it is an integral part of how the country can progress, namely investing in resilience.
Okay, thank you very much, Professor Vinod Thomas. There you have one of our visiting professors. And if you are interested to hear more and see and meet Professor Vinod live, all you have to do is be part of the next batch of our EMDRCM program where he and other professors share their wisdom, their expertise, and their experience in getting us to that safer, better, more resilient place in the future. Thank you so much, Professor.
Thank you, Wally, and best wishes to everybody.
You too. Okay, so that was our fourth live episode. And we are, again, as part of the requirement, we have some announcements to share with you guys. There are basic reminders that the World Health Organization has issued about keeping us safe and preventing the spread of the virus. It's out on social media and make sure you go through them. It's very straightforward. Wash your hands regularly, avoid contact with your eyes, mouth, and nose. Avoid large gathering of people. If you need to cough, cover it with your bent elbow, with the bend of your elbow or a tissue. If you feel a slight fever or cough, stay at home. Get better. If you manifest with fever, cough, and difficulty breathing, get medical care early on. But the World Health Organization prescribes that you call first in advance so that the hospital, the medical care facility can take better care of you. And stay alert with the information about the virus so that you are in the know. But that being said, there are also a lot of misinformation, disinformation out on social media and other platforms, and we encourage you guys to share from the credible sources. Credible sources like the World Health Organization and the DOH can give you a better sense of what's going on and what it takes for us to all become more resilient as a community. So, the things that we have to remind people about our efforts, master classes on building area resilience for Calabarzon will push through tomorrow in Lima Park Hotel, Malvar, Batangas. March 14, Seda Hotel, Santa Rosa, Laguna. Registration starts at 12 p.m. This will be about business continuity planning in the midst of COVID-19. And so the private sectors and the different organizations in Batangas and Laguna, you might want to take part in that particular masterclass so that you can also learn from the expertise and the experience of the other groups in that particular masterclass. And note, after the masterclass, the group leading that event will also be conducting the Asian Institute of Management admissions test, and you can take it there free. Otherwise, you would have to pay an amount to get that test administered to you. And then for the Bicol leg of the roadshow, Reimagine Bicol, Leading Innovations for Sustainable Development and Disaster Resilience, is still scheduled March 20, Naga City, Avenue Plaza Hotel, March 21, Legazpi City, the Oriental Hotel, at 1 to 5 p.m. Details about this and other events are posted at the Asian Institute of Management Facebook page. So keep tuned into those announcements. If there might be cancellations, we will let you know as soon as possible. Now, before I let you go, shout out to Miss Awi Macpaz. She commented about what the efforts that we're trying to do with the live stream, and we hope to get more. Thank you for that comment, and we hope to also spread the word about trying to build a more resilient Philippines for everybody. Thank you, and watch out for our next live stream.